So there's a number of different treatments and strategies to use for this. The first is talking about it. This is a very common problem. Most people with Parkinson's disease get this. It doesn't mean you're going crazy, okay? Because many patients will hide these hallucinations, sometimes for years. I've seen, just because they don't want the family members to think they're going, quote unquote crazy. So just talking about it and say this is part of the disease process. It's caused by the Parkinson's disease itself. It can be worsened by medication. It can be worsened by any other medical problem. So a bladder infection, dehydration, other medications too. So our first treatment issues is discussion, seeing if there are exacerbating features, like they have a UTI that we can treat, discussing whether we can back off on certain medications, both Parkinson medicines that contribute to hallucinations and non-Parkinson medications, so anticholinergic medicines, benzodiazepines. Quinolones is a real common one, so antibiotics can sometimes worsen PD hallucinations. And then with regard to the Parkinson medicines, amantadine, dopamine agonist, probably attributed to hallucinations a little bit more than levodopa, but this is going to be a case-by-case basis. Can you reduce medications? Because you may or may not be able to, depending on the whole picture. Subsequently, your options are to add a medicine to treat hallucinations. Now, the problem is most of the antipsychotics out there, including most of the ones marketed as atypical or second or third generation or whatever generation we're up to, still do block dopamine receptors. Okay, and once you block dopamine receptors, you tend to worsen motor features in Parkinson's disease. It can be very sudden, but more commonly it's a little more indolent over weeks to months, and it's usually gait disorder that worsens, but any motor feature can worsen. The three drugs out there that don't do that to largely are quetiapine, pimavanserin, and clozapine. Okay, so these are medicines that have predominantly antihistaminergic and anti-serotonergic effects, and only one of them, pimavanserin, which is marketed as Nuplazid, is FDA approved for treating PD psychosis. There is very little data in the literature supporting the use of quetiapine for PD psychosis, but it's a very easy medicine to use, and it's very good sedating medicine because it really is extremely potent antihistamine. There is some older good data for clozapine for PD psychosis, but historically that has not been used as commonly because it used to require frequent blood testing for agranulocytosis, a restriction which has recently been changed such that it may actually be much more easy to use clozapine going forward.